Communique reached at the joint meeting of the Coalition of Civil Society Against COVID-19 in Cross River State on the Wednesday, 29th April 2020 in Calabar. Good morning, everyone. Gentlemen of the press, you're welcome to the maiden edition of Cross River State Coalition of Civil Society Against COVID-19 Situation Room Briefing. In the meeting, which had in attendance 13 members representing 9 civil society organizations working in Cross River State, measures taken by the state government to ensure its citizens are safe even when the state is yet to record any confirmed case of coronavirus were reviewed. The Coalition of Civil Society Against COVID-19 acknowledges the government of Cross River State and other relevant stakeholders, as well as the Presidential Task Force against COVID-19 for the steps taken so far. We note particularly the early deployment of facilities such as logistics for political, health, and security personnel, ongoing work on isolation center in Calabar, the directive of the closures of the state borders, and the guidelines on personal and respiratory hygiene. We further appreciate the various channels deployed by the state government for preventive education, information, and communication, including the no masks, no movement policy. We, the Coalition of Civil Society Against COVID-19, have therefore called this briefing to put across to you, the government and the wider community of Cross Riverian, our observations and recommendations, which we hope government will find it and act on the immediate effect to deepen the response and continue to buy the confidence of our people for a COVID-19 free state. Our observations. 1. The setting up of COVID-19 isolation center at this stage of the response is still work on progress, with a lot to be accomplished. 2. The ongoing media coverage of the pandemic, prevention and impact is acknowledged, but could be better in content and reach. 3. The policy of free distribution of face masks does not seem to fully understood by the citizen, leading to their economic exploitation, as the present centralized method has not served the policy well. 4. The distribution of palliative across the state is not only low in accountability, but clearly excluded critical vulnerable segments of the society, notably persons with disability, persons living with HIV, orphans and vulnerable children, etc., which are most impacted by the COVID-19 related restriction. 5. There is unrestrained entry and exit route in the north and eastern borders, which are mainly turnout land borders. And 6. The composition of the state COVID-19 response team is without the visible involvement of civil society community, thereby unwittingly denying the state the pool of experience in community system strengthening, behavior change, communication, and citizen engagement. Many other states are leveraging on this experience to deepen their responses to the pandemic. Our recommendations. Based on the above preliminary field findings, the coalition wishes to make the following recommendation. 1. Ensure the speedy completion of the state-owned isolation center in Calabar for certification by NCDC, while work at least 2 more to cover the other 2 senatorial districts of Cross River State would commence. 2. The ongoing media coverage of the pandemic, prevention and impact should be deepened to deliberately cover the rural areas using community-based information dissemination mechanism. 3. That the state tax team should step up measures on our land borders to ensure migrants do not use this turnout route to put the state at heightened risks of the virus. Our community report indicate that routes in or out communities such as Urban Corridor of the Cross River National Park, Bakassi, Itu Bridge, Calabar-Run Waterways, Abi, Biase, Obubra, Eastern Buki, Etun, Ikom, Bekwara, Oburu, and Obanliku, among others, are in need of tightened monitoring by credible security operatives with support of the civil society organizations and community vigilante structures. 4, that the palliative distribution of food items, which has been widely condemned as insufficient, as well as its channel of distribution, should accommodate members of civil society organizations with verifiable data of vulnerable population. 5, that the government free marks distribution process should be decentralized and transparent for easy access by members of the public, other than present compulsory requirement of going to the garment factory for pickup. 6, that civil society organizations should be involved in the COVID-19 state tax team press briefing for accountability purpose and accredited reach to the vulnerable population with database within its constituency of civil society organization. 7, that persons living with disability and persons living with HIV should be adequately targeted and reached with the state response programming. Such provision should include a sign language translator during each state press briefing as obtained in other state broadcasts. 8, that the state should, while allowing markets to open, put in place effective structures to enforce physical distance and personal hygiene procedures within the markets. Otherwise, the progress made by the state thus far could be negated and cleaned out. We on our part shall be willing to support government effort through resourceful skill, qualitative data, and remain accountable to the interests of Cross River states. We shall continue to support the government through monitoring and evaluation of its program and mirror the citizens' response back to government to improve the overall state and community level responses to this global health challenge. This is the first of our feedback on the ongoing effort to keep Cross River COVID-19 free. This press briefing session shall continue as situation arises. We thank you all for coming together as civil society groups to support the fight against COVID-19 free in the state and Nigeria at large. We thank our various media partners, representatives of various civil society organizations, community-based organizations working on this stuff across the state, including persons with disability, for their doggedness, commitment in the face of dire logistic and resource restraints. On our collective vision is a Cross River state, nation, and indeed world free of COVID-19, so each one tell everyone. Thank you for listening. Signed, members of civil society against COVID-19 in Cross River.